Patients are more than their diagnosis. You know, it's so many factors. Each patient is unique, and we have to tailor a therapy to the uniqueness of the patient. It's very rare where someone has to go somewhere else to get in a trial. It's rare that someone has to go to Ann Arbor or the Mayo Clinic to get in a trial that's not offered here, because we're in all the cooperative groups that all the physicians here are investigators for, and it's routine. I've been here, what, 8 or 9 months, and I've had a number of people in trials already, I think over 10 already, and all the other physicians, Dr. Payne, Dr. Vermurray, Liebman, you name it, hecky, they all have an incredible amount of people on trials for a community cancer center, which I bet percentage-wise would rival what they do at most universities. A magnificent group of physicians, social workers, dietitians, you name it, we have it. Support groups, you know, the elevators, the whole entire center is filled with things to help our patients. You know, psychologists, psychiatrists, and so we have everything under one roof, not just chemotherapy and radiation, but everything else we need for psychological, dietary help. Clinical trial nurses, we have wonderful clinical trial nurses here. I'd like to say you don't have to go to Ann Arbor, you don't have to go to the Mayo Clinic to get in good clinical studies. We have excellent trial nurses here. So when you have everything under one roof and a very nice group of people that put together a team approach, I think we have everything you need here in Kalamazoo.
Bronson and Borges Hospital, for example, own one helicopter, not two. It helps them to save money. And the idea behind having two hospitals do a joint effort to own one cancer center not only helps save the hospital's money, but also allows for more unity in the community. I think it's a very good idea, and it's been working very well for all three of these places. A big world of treatment modalities waiting for the patient after me, including psychosocial help that can be there for the patient, exercise programs, cooking, nutrition, a holistic approach to the patient care, that the patients will encourage a patient to take part in his or her own care, not just depend on us, because when they go home after a few minutes of treatment here, they have 23 more hours of their day to live, and this is going to get them through a little bit more easy, getting through with more information and more care. I had a patient who had prostate treatments, and he actually ran a marathon while he was undergoing treatment, and he had absolutely no side effects, and I think so much of that could be attributed to his activity of exercise. It really helps beat fatigue. And I had another patient who's still under treatment, and she's telling me that she's using our exercise equipment facilities, and she exercises every morning, and she's one of the few patients I have who have absolutely no fatigue during their breast cancer treatments like she's experiencing. Kalamazoo is not Detroit or Chicago, yet we have the most advanced equipment. So I think you get the best of both worlds.
I think it's very nice for the patient. It's more of a holistic approach. We have a dietitian on staff. We have 2 psychologists who are excellent on staff to help patients kind of cope with the diagnosis of cancer, and also for their families. But there's also other things. There's exercise programs, there's yoga, actually cooking classes, how to eat healthy. So I think if they're looking for other things, patients not just chemo and radiation, there's a wide variety of things for them to get involved in. I believe that we can do anything anyone else can do. Sometimes at academic centers such as University of Michigan, University of Chicago, MD Anderson, the Mayo Clinic, they might have in-house trials that we wouldn't have here that look at experimental drugs, but we have most of the major national trials open here. So I think, again, we can offer, the best care as anywhere right in Michigan. There are some cancers that used to be thought of as not curable that are very curable now, such as Hodgkin's disease. There are some that are still very challenging, but I think the hope out there is that there's a lot of research going on and there's always new things coming up every day. And so if maybe we don't have something today, we might have something tomorrow.
You come here because it's a more friendly environment, we're close-knit. It's kind of like creating a new family for them. They have an extended family here. It's not as if we were moving them through kind of an assembly line like some of the bigger places do. We have a very warm, inviting, small environment that we get to know them their whole family lives. The patients, we know them, if they're having a bad day at work or they're having a good day at work, we get to talk to them and be more intimate. It's a more intimate setting here. The patient first comes in, they're scared and apprehensive and fearful. What we do is help them realize that we're here for them, mind, body, and soul. It makes this facility unique because of the real caring environment we have. We have a great group of people and they work together wonderfully to help the patient get all the support they need, from treatment to emotional support.
Everyone is nervous and afraid. The majority of the patients that I see in radiation therapy, which I see often daily, are, after they're here, their comment is that they really it was such a better experience than they expected. A lot of our patients actually miss us after they're done with their therapy, if you can believe that, and they stop in and see us. I mean, I feel like you will be in great hands and we will help you through your treatment. This whole building was designed with treating cancer patients and for their, for positive for treating. I mean, it's a beautiful facility. We offer so many resources. I feel like the patients get top-of-the-line care that they deserve. Most patients, when they have cancer, become more positive, and they're really a great bunch to work with. It's really rewarding.
A site logistically is just easy to get to. It's easy to go from, radiation oncology, and if you have a question for your doctor upstairs, you can talk to them as well. And then you have the nurses, the CCOP nurses who take care of all the clinical trials. All of it's in one location. I think that's a big benefit for patients. The first day or two that patients are on treatment, they're very nervous. They have a lot of questions to ask of us, and I think we do our best to put them at ease. And I think once they realize it's not a horrible situation they're in, it's not the worst place to go to on a daily basis, they loosen up. They feel comfortable about coming here, and suddenly we're parts of their family. So, and that's another reason I probably went into this field, is being able to feel like I am part of someone's family and helping them. Here, you're not alone. You have this feeling of family. You have this feeling of, if you need a question answered, you can get your question answered. Just a general sense of positive thinking people, and just feeling like you're part of a bigger group.
There's all different attitudes towards this horrible disease. There's a lot of everybody handles it differently. Men handle it different than women. I can usually tell the angry patient, maybe anxiety, it's fear. It's absolute fear. After a few visits with us, though, that fear goes away. They realize that they're in good hands and we're taking care of them. They get in here. They're in your heart. Every day, they're part of our family here. And they wonder, how do you remember my name or something like that? And they're a part of my family. This is just second to none. And I remember one of our employees that worked here that passed away a few years ago, he told us, he'd been to many of them around, and he said, this is the best place. And I know that. The most wonderful place, from the top administration down. The leadership is fantastic. The mission statement that she's directed us on, where we're going with things. I just beam when I can tell somebody where I work. It makes me just warm all over.